Good afternoon and welcome to the July 16th Community Update. My name is Stacy Wood and I serve as a Public Information Officer here in the Emergency Operations Center. This Community Update is available in Spanish on the Buncombe County Health and Human Services Facebook page, and that can be found on Facebook at BCHHS. All of our community updates can be found on the Buncombe County YouTube channel and on the Buncombe County government Facebook page as well, and that's at Buncombe.gov. Today's updates include information provided by Dr. Jennifer Mullendore, Buncombe County Medical Director and Interim Public Health Director, Dr. William Hathaway, Chief Medical Officer for Mission Health and the North Carolina Division of HCA Healthcare, Dr. Tony Baldwin, Superintendent of Buncombe County Schools, and Ashley Michelle Thublin, Director of Communication for Asheville City Schools. And we'll get started with Dr. Mullendore.
Good afternoon. Lab-confirmed cases of COVID-19 in Buncombe County continued to rise dramatically over the last week. Based on the data on the state's COVID dashboard, there have been 992 lab-confirmed cases of COVID-19 in Buncombe County residents as of noon today, an increase of 215 cases from the same time last week. As we've seen over the last several weeks, most of these new cases are occurring in young and middle-aged adults and are not linked to long-term care facilities. Currently, more than 55% of lab-confirmed cases in our county have been in people between the ages of 18 to 49. This virus doesn't care how old you are. If given the chance, it will infect you, make you sick, and possibly kill you, and use you to spread to your family, your friends, your coworkers, and others with whom you have close contact. We are seeing many cases tied to household contacts, coworkers, vacations with family and friends, attendance at parties, and other gatherings. Sadly, 42 county residents have died as a result of their infection, including 37 residents of 4 local long-term care facilities. Our public health nurses continue to work long and hard to reach out to each of those individuals, to provide guidance on isolation, and to determine their close contacts in an effort to prevent further spread of the virus. However, with the long time it continues to take to get some results, if you are tested because you have symptoms of COVID-19 or because you were a close contact to someone with COVID-19, we ask that you stay at home, away from others, including those in your household, while you wait for your test results. Additionally, because this virus spreads so easily within households, if you were tested because you have symptoms of COVID-19, everyone in your household should stay at home as much as possible until your results are known. Since the start of the COVID-19 pandemic, there have been outbreaks at 12 long-term care facilities in Buncombe County, including 10 with active outbreaks. Thankfully, most of these outbreaks are small, affecting a handful of staff and residents. However, that doesn't make them any less dangerous for the staff and residents at those facilities. The increase in outbreaks in these facilities is a reflection of the increased spread we are seeing in our community. Over 20,000 COVID-19 tests have been performed on residents of Buncombe County and staff who work in long-term care facilities in Buncombe County since the start of this pandemic response. The way to tell whether a rise in cases is because of increased spread in the population rather than a result of performing more tests is by looking at the percent of tests that are positive. In North Carolina as a whole, 9% of COVID-19 tests performed are coming back positive. This percentage has been stable for the past several weeks. However, in Buncombe County, over the last couple of weeks, we've seen a greater percentage of tests come back positive for COVID-19. This indicates that we are seeing more spread of the infection in our community. 2 weeks ago, 2% of COVID tests on county residents came back positive for COVID. Last week, it was 4%. Currently, 5% of tests on county residents are coming back positive. We must all take actions to protect ourselves and prevent further spread. It is up to each one of us to keep ourselves, our families, our friends and coworkers, and the most vulnerable in our community safe. If you meet any of the following criteria, we are recommending that you get tested for COVID-19. Anyone with symptoms of COVID-19, such as fever and chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, sore throat, a new loss of taste or smell, nasal congestion, runny nose, nausea, vomiting, and diarrhea. Anyone who's a close contact of a known positive case, whether or not you have symptoms, and people in the following groups who believe they may have been exposed to COVID-19, again, whether or not they have symptoms. These are people who live in or have regular contact with high-risk settings like long-term care facilities, homeless shelters, correctional facilities, and migrant farm worker camps. People who are at high risk of severe illness, such as people over the age of 65 and people of any age with underlying health conditions. People from historically marginalized populations, meaning Black, Indigenous, and people of color. Healthcare workers or first responders. Frontline and essential workers in settings where social distancing is difficult to maintain. And people who attend mass gatherings of any type, particularly if they're in crowds or in situations where they can't practice effective physical distancing. If your healthcare provider does not offer testing, contact one of the local urgent cares or clinics that offers testing. And the state website has a Find My Testing Place resource with up-to-date information about testing locations across North Carolina. Buncombe County Government and Western North Carolina Community Health Services will continue to offer COVID-19 testing at community-based sites throughout the county over the next several weeks. The next testing site will be this Sunday, July 19th, from 1:30 to 5:30 at AB Tech off Genevieve Circle in the Allied Health Building parking lot. And then next week, we will begin the 4th round of testing at the same sites as in prior weeks, so that on Tuesday, July 21st, testing will be available in East Buncombe in the parking lot of the Ingalls in Swannanoa. And Thursday, July 23rd, testing will be in Inca at the Buncombe County Sports Park. As in prior weeks at both the Swannanoa and Inca locations, testing will be offered to staff of our smaller congregate care facilities from 9:30 until 10:30, and then open to the general public at 10:30. There is no out-of-pocket cost for the testing at these community testing sites, but we do ask that those with health insurance, including Medicaid or Medicare, bring their insurance card with them so that insurance can be billed to cover the cost of the test. Due to the recent increases in testing nationwide and the supply chain issues at some labs, LabCorp and other large commercial labs continue to see increases in specimens being sent to them for testing. And as a result, the time it takes to get test results has increased to about 1 week. Unless you are a resident or a staff of a long-term care facility in the midst of an outbreak, or unless you've been directed to get tested again by a public health nurse or your healthcare provider, at this time there is no recommendation from public health for anyone without symptoms to be tested repetitively. Getting a COVID-19 test just because you're curious is not advised and further diminishes our needed resources for Buncombe County residents. Anyone who has a positive test result, meaning that they have COVID-19, will be contacted by a public health nurse. And those who were seen at the community testing sites are able to get their results online through the LabCorp patient portal. Per LabCorp, test results will be delivered to the portal as soon as they are available. Individuals will need to register or sign into the portal at patient.labcorp.com, and registration does require the entry of the last four digits of the person's social security number or a valid driver's license for identity verification via text message or email. As I've said before, the virus that causes COVID-19 doesn't care who you are or what you believe. If given a chance, it will infect you and potentially make you sick. And even if you don't get sick, it will use you to multiply and spread to your loved ones, your coworkers, and those with whom you have close contact. Wearing a mask or face covering is a simple but powerful action. It is one of the most important actions, if not the most important action that each of us can take to control this virus. Keep your physical distance from others and wash your hands. And today, it is also the time to remind parents about required immunizations for school entry for children from K through 12. Please make sure your kids are staying up to date on their immunizations. We know that during this pandemic, many children were not getting their required immunizations. So please contact your child's medical provider or call the Buncombe County Immunization Clinic at 828-250-5096 to schedule a visit. We stand with our community, with our schools, with our healthcare providers, as we all strive to beat this and to come back stronger. And we ask that you stand with us by making safer choices to protect our community. Thank you. I'll now turn it over to Dr. Hathaway.
Thank you, Dr. Mullendore. It's a pleasure to be back today. I have just a few very brief comments, most of which echo Dr. Mullendore's repeated pleas for the community to help us continue to flatten the curve. There's been much in the press lately about the number of cases at Mission Health System and Mission Hospital in particular, and I want to confirm that the numbers that you're seeing are indeed accurate. We have seen an increase over time. I've referenced these similar numbers in the past, saying that in the early stages of the pandemic, we were seeing about 2 to 6 per day. We had an increase into the 15 to 20 per day range, crept up into the low 20s, and now we're seeing daily case counts in the low 30s. While this number is definitely increased, I would like to put it in the context of what other health systems and states are seeing around the country. The numbers remain relatively small overall, and certainly within our ability and capacity to take care of the patients who are confronting us. We have, or are coming to us for care, we are having increased supplies of PPE daily. We have increased testing capability, although it's not as robust as we would like at this point in time. And we have certainly ample ventilators and rooms and staff at this point in time to care for the patients. What gives me anxiety in the context of those reassuring statements is the unknown future. We have seen what can happen in states like Texas and Florida, even South Carolina, Arizona, California. Those case counts rose dramatically when people had a significant increase in their community mobility. And I'm asking and reiterating that we can flatten this curve, and I'm asking your help to do so by continuing to diligently practice the 3 W's. Wear a mask, wait 6 feet apart from people, and wash your hands repeatedly. And on top of that, be judicious when you go out into the community. Think about what trips are absolutely necessary. Our actions today will protect us tomorrow. And when we're wearing the mask, I ask that you think not of the mask as a protective device for yourself, although it certainly does that, but I ask that you think of it as a protective device for other people, that you're wearing the mask so that you don't inadvertently spread the disease to them. Thanks very much.
Good afternoon. I'm Tony Baldwin, Superintendent of Buncombe County Schools. I want to start out by saying that the governor's decision this week regarding the start of the school year is appreciated from the educator's standpoint because it allows us to narrow our focus to address the many details and challenges that come with Plan B. Likewise, because we are offering a full remote option for all students and parents, the components of Plan C are also being refined in order to provide a rigorous remote experience with accountability and consistent expectations. We appreciate the governor's announcement as well regarding facial coverings for all students, staff, and visitors. This was a decision, by the way, that our school board also made a week prior. We are currently in the process of obtaining detailed information from families, which includes the number of students who will opt for a remote learning experience for a minimum of 1 semester. In addition, we are requesting that our families tell us if they need bus transportation in the morning and/or in the afternoon. If BCS families have not completed one of our questionnaires, we ask that they email their principal as soon as possible with these preferences. We've also begun town hall meetings to communicate with teachers and staff in each of our 44 schools. During those sessions, we will be providing updated information on Plan B and Plan C logistics and offering them an opportunity to ask questions. Parents and students will be receiving a significant amount of information in the coming weeks. Our area of emphasis will be on health and safety protocols in each school, such as daily temperature checks, which will occur at the bus stop, car rider line, and building entrances, the requirement for face coverings, such as cloth masks or clear face shields, and certainly the daily mantra that we've heard before of the 3 W's: wash hands, wear face coverings, and wait 6 feet apart. If you have not received any of our communications in the last few weeks, we ask that you reach out to your school because that information is extremely valuable to our planning and preparation. Also, Buncombe County Schools has created a landing page where you can find all of the latest information, and that is returntolearn.buncombeschools.org. I want to thank the leadership of our county government and our local Department of Health and Human Services for their support as we continue to make key decisions in response to this pandemic. We will turn to our public health experts in collaboration to respond to the challenges as they arise. I want to close by recognizing the one constant theme of COVID-19 response for Buncombe County Schools since March, and that is in capital letters, change. While we may begin this school year in one plan or stage, the reality is that at some point in time in the future, we will find ourselves in a different plan or stage. Whether this is a statewide decision by the governor or made by our Board of Education to address the local COVID-19 metrics, that may require a more restrictive plan than the governor. As Fletcher Tove has said before, the next 3 weeks in the COVID-19 world is an eternity. Thank you.
Good afternoon. My name is Ashley Michelle Thublin, and I'm the Executive Director of Communications for Asheville City Schools. As Dr. Baldwin just said, Governor Cooper did indeed announce that all school districts across the state have the option to start under a Plan B model. When it comes to a return to learn plan, there are certainly no easy answers. Nonetheless, our district has and will continue to work through these challenging scenarios. Yes, a new school year is beginning, And yes, we are in the midst of a global pandemic, but our top priorities do remain the same. Number one, keeping our students and staff safe, and number two, educating our children. Now, something that is a bit new is realizing all too well that many of our parents need to get back to work. And a huge component in supporting our families through this is beginning to allow our students to return for some in-person learning, even if it is at a limited capacity in full compliance of social distancing and full safety measures. Therefore, at this time, our pre-K classrooms will open on August 17th across all sites with reduced capacity. Our rising kindergarten through sixth graders will receive both remote and in-person instruction with additional restrictions for social distancing. At each grade level, 75% of our elementary and sixth grade teachers will be assigned face-to-face instruction and 25% will be assigned virtual instruction, which they will carry out from their classrooms. Students will be divided equally between face-to-face and virtual instruction with larger virtual groups and smaller face-to-face groups to allow for social distancing. On the weeks that a student is receiving in-person instruction, they will be following the traditional bell schedule. For elementary, that's 8 to 2:30 p.m., and for our sixth graders, that's 8:30 a.m. to 3:30 p.m., as well as stay with the same group of students throughout the day. Their teacher will focus on introducing new concepts and skills, as well as enhancing classroom-based instruction with those hands-on activities. On the weeks that a student is receiving virtual instruction, they will be divided into one of three groups. The virtual teacher will meet with each student group for 1 hour each morning, so don't worry, our kinder and first graders won't be sitting in front of a computer screen for 6 straight hours. Following lunch, our virtual teacher will follow up with some office hours to provide additional support, as well as virtual small group instruction. During at-home learning weeks, our students will focus on reinforcement and application of what they learned the previous week, brush up on some vocabulary, as well as be introduced to new concepts that will be explained the following week in greater detail. Additionally, similar to Buncombe County, I would be remiss if I didn't let y'all know that Asheville City Schools is committed to offering a virtual option for any rising kindergarten through sixth grader who wishes to complete all their assignments from home. As you begin to decide what is best for your child and your family, please know that we have shared a survey with our rising kindergarten through sixth grade families. That survey is also available on our website and will stay available through today. Please understand that if you complete that survey, in no way is that locking you in, it's just allowing us to gather some more information. That's a lot, and that's just for our rising kindergarten through sixth graders. Regarding our 7th and 8th graders, as well as our rising high schoolers, they will continue to access remote instruction, partnering virtual whole class sessions with lessons through Canvas, which for those of y'all that don't necessarily have a child within our school district is an online platform that allows our teachers to build virtual learning environments that support us in meeting the unique challenges of 100% virtual instruction while still allowing our teachers and students to build those ever important relationships. Due to the unique layout of Asheville Middle School, Montford North Star Academy, and the Asheville High School Silsa campus, we believe in Asheville City Schools that it is imperative to have a slower reopening plan that allows us to carefully plan and maintain safety protocols for those campuses, taking into account the movement required in the 7th through 12th grade student schedules and higher teacher-to-student ratios at that middle and high school level. You may not know this, but each middle and high school student actually has an individual schedule that's been tailor-made to fit their unique academic and special interest needs. This means that our students don't move throughout the building as an entire class. Therefore, it's incredibly difficult to maintain required social distancing throughout the school day for each and every student, which is why we're taking our time on this one. Our rising 7th through 12th graders are also the most familiar with a remote learning environment, as their at-home learning actually started with campus classrooms on March 17th, our very first day of at-home learning. Depending on their grade, our 7th through 12th graders will either participate in 4 or 6 45-minute periods that include live online whole class sessions each morning. Of course, knowing that several of our older students also care for younger siblings, they'll also be recorded. In the afternoon, our students will offer office hours to provide additional one-on-one support and small group instruction. This will also be the time where students work on that independent learning through Canvas platform that we talked about earlier. Asheville City Schools' ultimate goal is for our rising 7th and 8th graders to begin our Plan B hybrid model, which our rising kindergarten through 6th graders are starting on August 17th, following the first 9-week period. Our hope is that our high school students will start transitioning to Plan B as well at the start of our second semester, which is in January. Of course, these plans are subject to change and will be contingent on the latest guidance from Governor Cooper, the North Carolina Department of Public Instruction, the North Carolina Department of Health and Human Services, as well as our very own Buncombe County Health Department at the time of that anticipated transition. So families, more information about that will definitely be coming out. Once again, I'd like to reiterate that we fully understand that no return to learn plan is perfect. However, we are dedicated to keeping our students and our staff members safe and educating your children, as well as being as transparent as possible. More information about our Return to Learn plan can be found on our website, and it's super easy, ashevillecityschools.net/return to learn. Again, that's ashevillecityschools.net/return to learn. Additionally, today by 5 p.m., we look forward to sharing more about our extensive sanitation and transportation protocols. For instance, did you know that the maximum number of students who will be able to ride a bus that traditionally seats 75 will only be 22 this upcoming school year? Or that we'll have a designated custodian in each building whose main responsibility is going to be wiping down those frequently touched surfaces. Think of door handles, countertops, desks, and those water bottle stations. And we'll also have plans put in place about what we're going to be doing to support your child's mental health, because that's really our top priority. Again, please visit our website or Asheville City Schools Facebook, Twitter, or Instagram pages for our latest updates. Or you can also just reach out to me directly. My number is 828-350-6120. Again, that's 828-350-6120. If I don't know the answer to it, I'm incredibly lucky to work with a way smarter group of colleagues, and I'm sure that they can help us through the process. Thank you for giving me this opportunity to share, and I couldn't say I'm part of the Asheville City Schools family if I didn't conclude with Cougar Pride.
All right, before we leave today, Fletcher Tove is not here today, but he wanted to send a reminder to our community that earlier in the week, Governor Cooper stated that the state will remain in phase 2 for an additional 3 weeks. So Buncombe County continues to align with the state guidance. The face covering mandate and specified business closures remain in effect. We urge all of our residents to continue practicing the 3 W's. And if you are a member of a high-risk group or are showing symptoms of COVID-19, please use the self-checker found at buncombeready.org to assess your symptoms and to receive further guidance and connection to a testing site near you. Thank you for tuning in today to this community update. We will provide the next community update on Thursday, July 23rd at 2 p.m. Thank you.